At the tail end of March, when everybody was focused on the prospect of potential tariffs, well, something happened over at the HHS. Specifically, the FDA's top vaccine official submitted his letter of resignation. Specifically, this right here is Dr. Peter Marks. He was the director for the Center for Biologics Evaluation and Research within the FDA. And if he happens to look familiar to you, well, that's likely because you were actually paying attention during the time of the COVID pandemic. His sub-agency, it was the one in charge of handling, regulating vaccines for the entirety of the FDA, meaning that he was in charge of the agency that was routinely giving their stamp of approval for new vaccines, for new booster shots, for new vaccine schedules, new vaccine advice, and so on, all things like that. Also, it's worth mentioning that Dr. Peter Marks, he was actually the man credited with coming up with the name Operation Warp Speed. Apparently, that was his creation as well after he spoke to someone who happened to be a fan of Star Trek. And also, just for your general reference, his sub-agency, it also handled things, besides vaccines, it handled things related to allergenic products, blood products, as well as gene therapies. And Dr. Peter Marks, he has been in charge of that agency for the past 9 years, since 2016, basically since the very beginning of Trump's first term in office. However, after RFK Jr. was sworn in as the head of HHS, well, Dr. Peter Marks was not really having it. On March 28th, he wrote this letter here, you can see it up on your screen, saying that he will be stepping down from his role within the next 2 weeks. Here is specifically what Dr. Peter Marks wrote. And just for your reference, this letter, it was addressed to Sarah Brenner, the acting FDA commissioner. And just for a visual organizational chart, the HHS sits at the very top with RFK Jr. at the helm. Below them is the FDA with Sarah Brenner as the current acting commissioner. And then within the FDA, you have the Center for Biologics Evaluation and Research, which is the sub-agency that Dr. Peter Marks was in charge of. And so essentially, this letter, he was writing it to his immediate boss. And here's what he wrote. And by the way, before I read you what he wrote, I will quickly mention that I hope you smash that subscribe button. We're so close to hitting 2 million subscribers. And on the back end of this YouTube channel, I can see that 42% of the people who watch our videos just haven't subscribed yet. So I hope you do. I hope that if you appreciate this type of content, which presents the news without any opinions, without any spin, without any slant, it just gives you the facts, gives you what people said, the background of what they said, and lets you make up your own mind. If you appreciate news content like that, I do hope you smash that subscribe button so that with some luck, we can reach 2 million subscribers by the end of this year. I think we can make it happen, and it starts with you smashing that subscribe button if you haven't already. Now, getting back to the letter, here is what Dr. Peter Marks wrote. Quote, "Over the past years, I've been involved in enhancing the safety of our nation's blood supply, in advancing the field of cell and gene therapy, and in responding to public health emergencies. In the last of these, during the COVID-19 pandemic, I had the privilege of watching the vision that I conceived for Operation Warp Speed in March of 2020 in collaboration with Dr. Robert Kadlec become a reality under the leadership of HHS Secretary Azar and President Trump due to the unwavering commitment of public servants at the FDA and elsewhere across the government. At the FDA, the tireless efforts of staff across the agency resulted in remarkably expediting the development of vaccines against the virus, meeting the standards for quality, safety, and effectiveness expected by the American public. The vaccines undoubtedly markedly reduced morbidity and mortality from COVID-19 in the United States and elsewhere." Then, further down in the letter, he went on to say that he is concerned about some people within the Kennedy camp who are questioning the adverse health effects of vaccines. And then he uses the example of Texas's recent measles outbreak as an example of why that's not a good idea. Quote, "Efforts currently being advanced by some on the adverse health effects of vaccination are concerning. The ongoing multi-state measles outbreak that is particularly severe in Texas reminds us of what happens when confidence in well-established science underlying public health and well-being is undermined. The 2-dose measles, mumps, and rubella vaccine regimen, otherwise known as the MMR vaccine, used over the past decades has a remarkably favorable benefit-risk profile. The MMR vaccine is 97% or more effective in preventing measles following the 2-dose series, and its safety has been remarkably well studied. Undermining confidence in well-established vaccines that have met the high standards for quality, safety, and effectiveness that have been in place for decades at the FDA is irresponsible, detrimental to public health, and a clear danger to our nation's health, safety, and security." Now, just to pause here for a moment, the measles outbreak in Texas that he's referencing, that actually began in January. RFK Jr., however, was confirmed as the Secretary of HHS in mid-February. And so this measles outbreak predates anything that RFK had to do with the agency. Also, it's perhaps worth mentioning that after the measles outbreak grew, RFK Jr. actually came out and he published an op-ed on the Fox News website, you can see it up on your screen, wherein he wrote that, quote, "The MMR vaccine is crucial to avoiding this potentially deadly disease." And if you scroll down in the body of that article, RFK Jr. then went on to sing the praises of the MMR vaccine, urging people to get it. And so for Dr. Peter Marks, in his resignation letter, to use the measles outbreak in Texas as an example, as a concrete example of how RFK's leadership might cause problems is a bit, you can say, incongruent. Since for one, that outbreak predates anything that RFK Jr. did in his role, and secondly, RFK Jr. is actively campaigning for the MMR vaccine. However, to be generous, I'm sure that the idea that Peter Marks was trying to get across in the letter is that if people question the vaccines, well, then he believes more Texas-like outbreaks will happen. And since RFK Jr. is overall beginning to investigate the safety of vaccines within the agency, well, then that's not good from an outbreak standpoint, at least according to the thinking of Dr. Peter Marks. Now, we here at the Epoch Times, we did reach out to Dr. Peter Marks for clarification regarding what specifically he meant in his resignation letter, but we have yet to hear back. All right, just to pause here for a super quick moment. Listen, it's obvious that the financial system is not looking too great. After being pumped up with trillions of virtually free government dollars for many, many years now, well, the stock bubble might actually burst in the near future. And in that process, unfortunately, it could take away the nest egg of anyone who happens to be exposed to it. And so consider taking this opportunity to diversify into something which is beyond the grasp of Washington, D.C. and Wall Street, physical gold and silver. And the best company to use, in my opinion, is the sponsor of today's episode, American Hartford Gold, who, I should mention, is also my own personal gold and silver bullion dealer. And besides myself, they have thousands of 5-star reviews from other Americans, and they also have an A+ rating with the Better Business Bureau. And working with them is rather simple. They have a huge selection of coins, bars, and rounds to choose from. They have super friendly staff who you can call, and they can set up either gold delivery directly to your doorstep, or they can even set you up in a gold IRA. And then lastly, best of all, if you tell them the Roman sent you, they will throw in a free gold coin with your first qualifying purchase. So give them a call. The number is 866-242-2352. That's 866-242-2352. Or you can simply text Roman to 65532. I'll also throw a link to their webpage. It'll be down there in the description box below. Regardless though, in his letter, he goes on to write the following, quote, "As you are aware, I was willing to work to address the Secretary's concerns regarding vaccine safety and transparency by hearing from the public and implementing a variety of different public meetings and engagements with the National Academy of Sciences, Engineering, and Medicine. However, it has become clear that truth and transparency are not desired by the Secretary, but rather he wishes subservient confirmation of his misinformation and lies." Now again, within the body of this 2-page letter, he doesn't clarify what misinformation and lies he's specifically referring to. The only concrete example he gave was the one out in Texas. Regardless, he begins his letter actually by saying that he's leaving his post. Quote, "It is with a heavy heart that I have decided to resign from the FDA and retire from federal service as the director of the Center for Biologics Evaluation and Research, effective April 5th, 2025. Now, because this letter did not really give any concrete examples for why exactly Dr. Marks decided to leave, I dug around a little bit to try to get the real reasons, the real behind closed door stuff that was happening within the agency that caused him to get pushed out like this. And lucky for me, just as he was heading out the door, Dr. Peter Marks went on something akin to a press tour, giving interviews to multiple outlets regarding what was happening at the FDA that made him want to leave. And so here are 5 anecdotes that I was able to collect from these different interviews, which together paint a picture of why exactly he was forced out. And note, I wasn't able to independently verify these accounts, and so I'm just presenting to you what Dr. Marks said without any commentary. The first is from his interview over with the Wall Street Journal. Quote, "Dr. Marks said he had been willing to work with Kennedy on streamlining the FDA, but Kennedy's reorganization had weakened his office. He expressed concern that the new secretary's efforts could chill private investment in medical research in the U.S. and leave the U.S. less prepared to fight biological weapons while allowing other countries to take the lead in developing cutting-edge treatments for diseases. And then further down in that same Wall Street Journal article, quote, in early March, Marks said Kennedy's team requested that Marks turn over data on cases of brain swelling and deaths caused by the measles vaccine. Data that Marks said doesn't exist because there have been no such confirmed cases in the U.S. And then a bit further down in that same Wall Street Journal article as well, quote, Marks said Kennedy's team was also interested in weakening regulation of unproven stem cell treatments which clinics and websites sell for diseases ranging from Alzheimer's to arthritis. He met with top HHS officials to discuss the issue, he said, and offered to meet them halfway by proposing a new set of regulations that would keep rules vigorous for risky treatments, but more lenient for less risky therapies. Dr. Marks then said, what they are trying to do is potentially dangerous. These stem cells, if they are made improperly, they can harm people. And then in a separate interview that he gave to the Associated Press, Dr. Marks said the following, quote, Marks agreed to give Kennedy's associates the ability to read thousands of reports of potential vaccine-related issues sent to the government's Vaccine Adverse Event Reporting System, or VAERS, but he would not allow them to directly edit the data. Dr. Marks then said, why wouldn't we? Because frankly, we don't trust them. They'd write over it or erase the whole database. And then later in that same Associated Press article, quote, Marks said he never spoke directly with Kennedy, whom he described as walled off from FDA officials. On the day he was forced out of his post, Marks said he was summoned to a meeting at HHS headquarters. After an awkward silence, Dr. Marks said one of the officials told him, look, he wants you gone. According to Marks, it was an obvious reference to Kennedy. Dr. Marks then said it was pretty clear that either I was going to resign or they were going to fire me. He then submitted his resignation later that day, citing Kennedy's support for misinformation and lies about vaccines. Now again, it is really worth mentioning that this is Dr. Peter Marks' telling of events. I have not been able to corroborate these stories, including that anecdote about RFK's team wanting the ability to write over the data in the VAERS system. And so take it for what you will. Also, I will mention that on the flip side, in the same Associated Press article, well, Dr. Peter Marks gave his piece, but they also interviewed a spokesperson for the HHS who said the following, quote, it would make perfect sense for staffers working for Kennedy to seek access to the VAERS database to do their own analysis. The HHS spokesperson also said that RFK Jr. is installing scientists committed to reversing the chronic disease crisis and that Dr. Peter Marks was a rubber stamp for the drug industry. And so that was Dr. Peter Marks. Although it is really worth mentioning that it's not only him. The departure of Dr. Peter Marks is part of a much larger trend of total restructuring within the HHS, which as an agency, rather as a department, is currently in the process of letting go of roughly 10,000 people.
The entire federal workforce is downsizing now, so this will be a painful period for HHS as we downsize from 82,000 full-time employees to around 62,000.
Quote, the reorganization, which will take 28 divisions down to 15, is expected to save $1.8 billion per year. The division that will be most affected is the FDA, with about 3,500 workers being fired. Meanwhile, the CDC's workforce will be reduced by about 2,400 employees. Some 1,200 employees at the National Institutes of Health will no longer have jobs. The Centers for Medicare and Medicaid Services, another division, will move forward with about 300 fewer workers. HHS said in a statement that many of the divisions contain redundant units. Officials are going to consolidate those units into 15 divisions. And so while having the top vaccine official resign from the agency does make big headlines, the reality is that it's just part of a much broader culling at the HHS with upwards of 10,000 employees getting laid off. If you'd like to read more about either Dr. Peter Marks, I'll throw both his letter as well as several interviews he's done in other media sort of explaining his rationale for leaving. I'll throw those links down into the description box below, as well as the links from the HHS, as well as from RFK Jr. himself explaining the rationale for culling the agency and gutting it and restructuring it and getting rid of 10,000 people. I'll throw those links down into the description box as well if you want to get deeper into the weeds and into the rationale for why they're doing what they're doing. And all I ask in return is that as you're making your way down there to the description box, if you haven't already, take a short detour to smash those like and subscribe buttons so that this video can reach ever more people via the YouTube algorithm. And also, leave a comment. Do you agree with what RFK Jr. is doing, that by restructuring Health and Human Services, he will streamline everything, make it a lot more nimble, make it more reactive to new scientific developments? Or are you in line with Dr. Peter Marks and saying that such large, broad changes might hurt public health either in the short term or the long term? Let me know your thoughts. Please leave them in the comment section below. I'd love to read them. I will be reading them later tonight as well as into the week. And then until next time, I'm your host, Roman from the Epoch Times. Stay informed, and most importantly, stay free.